you think makes Mehana Institute stand out? And yes, like this.
Yeah. So we emphasize the educative aspect,
Okay.
So my my wish or goal is to help people to understand better the psychosomatic patterns and understand what happens in the body and understand the mechanisms of how the illness can be born, and explain them how they can influence their health. So this is, I think, what is special about Mehana Institute is that we also like to make the people, medical doctors themselves a little bit, if I exaggerate, to encourage them uh, to use their bodies and minds and the surrounding nature as instruments to help them to maintain good health and prevent illness. So aside the health beneficial effect of our practice, this, what I mean, is very important, and what makes also Mehana Institute unique is to make the people more independent, like more autonomic to handle their health. And this is through the um, recognition, through so let's tell that we like the people to open the eyes and see, for example, how they can use their breath to influence their health in many aspects. And speaking about breathing, about breath, uh, there are many health aspects. The breathing techniques have their benefit. For example, on the immune system of the airways. Breathing techniques can also help a lot in the gastroesophageal reflux by changing the angle of the diaphragm. They can also help a lot in the chronic lower back pain, because when even by the movement of the diaphragm, you can make kind of physiotherapy to your lumbar vertebrae. Breathing techniques can help also a lot to drain your inner organs, to work with your inner organs, because by some movement and compression, you can mechanically reinforce the lymphatic drainage of your inner organs. And there is another aspect, interesting aspect, which of breathing techniques, which gets like beyond this mere mechanical mechanism. And this is also the theory of vagus nerve, because through deep diaphragmatic breathing, we stimulate the vagus nerve. And now there is a lot of new research about this nerve, which is considered to be very important in the regulation of immune system and also of the stress-related diseases. And it also regulates the cardiovascular system. So just see how large a scale you can influence by the breathing techniques. This is why the breathing techniques are now so popular. And when you explain, everybody can learn it. And if you explain to the people exactly, okay, when you do this kind of breathing techniques, you will focus on this aspect, for example, of your inner organs, then it is much more efficient when they really understand the mechanisms, and when they practice it, they can really help themselves so effectively. And I already have these results with my clients, so we have a lot of feedback from them, so they appreciate a lot this. Yeah.
And your programs are also meant for medical professionals. Is it true?
Yeah.
So why? Or
What is the goal?
like, are you happy if medical professionals join your programs?
Absolutely. And they are, many of them, like some nurses, physiotherapists, some general practitioners who join our programs for their own choice. But now we are in the phase when we really like to focus more on this medical community. This is what patients me really. I like to interact with medical professionals. And why? It does not mean to tell them, okay, you stop to do surgery, you stop to do this, just you will
tell patients how to breathe and how to move.
No. It's just, it's the goal is to enlarge their practice in this holistic approach. And so usually when the medical professionals join our programs, they are themselves motivated to enlarge and complement their practice by the complementary non-invasive and non-pharmacological techniques. And another motivation for them is that now the number of patients who require non-invasive and non-pharmacological treatment raises remarkably. So there are more and more people now, and now it's really remarkable that they ask, okay, you like to prescribe me fourth antibiotics? Is there other way? I don't want to take antibiotics anymore. Do you have another option? Or, for example, I have some lesion of my meniscus, but I have doubts about the operation. Is there any other approach? And of course, there are some emergency cases. There is no way to consider other than conventional approach. But in many cases, like the chronic pain, chronic diseases, like mild infections, or even some neurodegenerative diseases, some mild psychiatric condition, etc., in many of this kind of diagnoses, there is another way. There is an option to the pharmacological and invasive approaches. And this is, I know that even among my colleagues, there are more and more of them who start to be interested about this because they see that their patients, they are requiring this. And at this moment, they have no answer for them because nobody thought of them. So this is why me personally, I'm also so motivated to transmit this experience and knowledge to the healthcare professionals and give it to them as a complementary tool to their practice in conventional medicine. I think,
yes. So do you think, like, if I start my own practice as a general practitioner, and then maybe I attended one of your courses, like 7-day Mehana program or something, do you think I already could have learned something from your teachings or from your lessons from this educative program, like that I could already get something to actually guide my patients if I see that they are interested in some other ways or something they can do more to have a better health, that I can already give them some advice or guide them.
Yes, absolutely.
Somehow.
For me personally, the most sensible are the multi-day programs, because then you can get much more deeper. Multi-day programs, because you can get much deeper into the subject matter. However, I have already feedback, because now we are really very interested about feedback from our patients. We have already feedback from doctors even and physiotherapists that even after one workshop, 2 hours workshop, they already got some hints, some tools they implemented in their practice. So whatever participation, I think, can already influence your practice. And I know it from my own experience, because of course I like to educate myself within the time. And I know that whatever workshop or course I attend, there is always something I can already implement. But from my point of view, the most purposeful are the multi-day programs, like 1 week at least, because there you have really time to get layer by layer and also try to practice. So it's important to tell that all what we are doing is very practical. So we emphasize the practice, hands-on, try, experience. So all the participants experience themselves this what we are doing here.
Nice.
So teaching.
So it's quite cool to go there and to join it, so to learn some of these techniques or understand it more. So my patients who are asking about different ways or who are not fully satisfied with the conventional treatment only can be more satisfied with me as a doctor if I can give them some other advice that's actually that I know could work or could help or could better their health.
Yeah,
right?
yeah, absolutely. I'm happy that you got it in this way, because this is the point. This is point, and so I hope that. Yeah, and also it's pleasure for us, because I love the interaction with the people, and I love interaction with the students, with the clients, because each of them has always something precious to bring, and I like so this is how I see Mehana.
Yeah.
Okay.
I want.